second annual statewide convening. And we're very happy to have you here. Tennessee needs all of us and all of you, so thanks for being here and being engaged. We're going to start the plenary this morning is about what happens in Tennessee if we lose the protections of Roe v. Wade. And we were just looking at the Senate floor, and the Kavanaugh vote should be, sometime this morning we will know what that decision will be. But whether it's him or not, it's going to be somebody, right? And so I think the idea that we need to start talking about this and making plans and trying to mobilize and strategize is really important. I am joined this morning by an amazing panel. To my right is Lynn Paltrow. She's the Executive Director of the National Advocates for Pregnant Women in New York. Ms. Paltrow. And to her right is Corinne Rovetti. She is on the steering committee of Healthy and Free Tennessee. She is the co-director of the Knoxville Center for Reproductive Health. And to her right is Ashley Gray with the Center for Reproductive Rights in New York. Ashley. And the guest who is traveling to be with us this morning is Dr. Danielle Tate. She's an MD at OBGYN from Regional One Health in Memphis. And so we will just slip her right in when she gets here, and we won't misspeak. So I'm going to give a little bit of an overview, and then each of our panelists have some remarks to share, and in the end we're going to open it up very informally just for a conversation and questions, because this is something that none of us really know much about because we haven't had to deal with it, so we're going to invite you into that conversation. And I'm Rebecca Terrell, sorry I forgot that. I'm the Executive Director of Choices Reproductive Health in Memphis, Tennessee. Okay, so the ruling of Roe versus Wade in 1973 established a woman's right to abortion as part of her right to privacy. Since that ruling, individual states have found dozens of ways to make it as difficult as possible for patients to actually access the procedure. From strict regulations on clinics and bans on abortion after a certain number of weeks, to requiring patients to receive counseling and undergo waiting periods, these laws have tested the limits of Roe, with some ending up in federal court. While much of the world is moving to reduce restrictions on abortion, some recent actions in Chile and Ireland, the U.S. is going in the opposite direction. President Trump was explicit in his bargain for support from the religious right. If elected, he would do everything possible to reduce access to abortion, including appointing justices to the Supreme Court who would rule to overturn Roe v. Wade. When Justice Anthony Kennedy, the Supreme Court's crucial swing vote on many matters, retired this summer, it became crystal clear that Roe could, in fact, be substantially eroded or even overturned. We've seen an explosion in abortion restrictions over the last decade, although it is worth noting that the American public has not become less supportive of abortion rights in that time. According to the Pew Research Center, 58% of adults today say abortion should be legal in all or most cases, while 40% say it should be illegal in all or most cases. These are basically the same numbers that they were in 1995. So, with the confirmation of Kavanaugh, the federal constitutional right to abortion may soon be over. It's time to think about and plan for a life without Roe in Tennessee. So we're going to start with Ashley to talk about the current law and level of abortion access in Tennessee.
Thank you, Rebecca. Can everyone hear me okay? Yes. Great, thanks everyone. So I am the State Advocacy Advisor at the Center for Reproductive Rights in New York City. We track legislation related to reproductive health and rights in all 50 states, but we really focus on about half of those where we sort of really double down and put a lot of time and effort and advocacy into fighting restrictions on abortion and reproductive health care access, as well as pushing for bills that would expand, proactive bills that would expand access in several ways. And we work on abortion, contraception, maternal health, as well as assisted reproductive technology is a new sort of budding area of work that we're engaging in. So last year in 2017, we updated a report that we had originally drafted in 2007 called What If Roe Fell? And this report takes a look at each state's risk factors. And I want to be clear that these are risk factors that the Center for Reproductive Rights identified in partnership with some of our partners and clients. So there are very many ways to interpret each state's risk factors, and so this is our reflection. And I'm going to give you a brief snapshot to explain to you where the state of Tennessee sits should Roe v. Wade either fall or be severely diminished. So first off, there's bad news. I'll say in Tennessee there's bad things and then there's not bad things. There's nothing really exceptionally great or protecting of the right to abortion access. So I'll take you through some of the basic things in the state of Tennessee that can be amended or hopefully maybe reversed someday should we have a really great turnout in November. So first off, Tennessee does not have a state constitutional protection for abortion rights. So what that means is that the highest state court has not held that the state constitution in Tennessee protects the right to abortion separate from any federal constitution rights. So what that says is if we lose our federal protection for abortion rights, there's nothing in the state of Tennessee that says people in Tennessee still have a right to it. Tennessee also does not have statutory protections for abortion rights. So what that means is the state hasn't passed a law that strongly protects the right to abortion in the state codes. State law would continue to provide protections if Roe fell, but is subject to legislative repeal and less secure than state constitutional protections, what we just spoke about. So there's no statutory protections, there's no constitutional protections. What is, I won't say the good news, but the not bad news is that there is no pre-Roe ban on the books in Tennessee either. So what that means is the state has not passed an abortion ban before 1973 when Roe was decided. And therefore, if Roe were overturned, a state that had a pre-Roe ban on the books state officials could just start enforcing it, or they could also, if the law had been blocked or limited, officials could file actions asking courts to activate a ban if Roe should fall. So Tennessee doesn't have any of that yet. There are also no constitutional gestational limits in Tennessee. The state what that means is that the state has not passed a law that would ban abortions before the fetus is viable, such as a 20-week abortion ban. Roe declares that a law is unconstitutional if it bans the abortion before viability. So note that also laws banning methods of abortion or abortion for particular reasons, like the sex of the fetus, are counted because states do not typically frame them as invitations to overturn Roe. So there are no unconstitutional gestational limits in Tennessee at this moment. And comparatively, 21 states in the US do have them. So Tennessee is sort of falling in the middle there. You also do not have any trigger ban. Comparatively, 4 states in the US do have trigger bans currently. And what a trigger ban means is that the state passed an abortion ban that is not immediate, but rather would spring into effect instantly if Roe were overturned. So these bans wouldn't require any legal action to go into effect if Roe were reversed or diminished. And like I said, 4 states do have these trigger bans. So Tennessee is relatively safe if, immediately if Roe is overturned. But of course that would open up the door for a lot of restrictions to come through. Comparatively, 24 states have at least one of those 3 bans that we talked about. So the pre-Roe ban and the trigger ban, at least, and unconstitutional gestational limits, at least 24 states have those. The current state legislature, I'm sure as you all know, is considered very hostile to abortion in Tennessee. The House makeup, the Senate makeup, and their governor are all considered anti-choice. And also there are significant anti-abortion policy statements on record. So as you all know, in 2014, Amendment 1 was passed in Tennessee, and the voters voted to amend the state constitution to withdraw existing abortion protections from the Constitution. Some other current restrictions and just some data points that I wanted to share with you that can kind of contextualize where Tennessee fits in the national landscape. You have a 48-hour waiting period currently for an abortion. There's also a physician-only law, which requires only physicians to provide abortion care, not advanced practitioners who are able to do that within the scope of their practice. So that's very limiting on access, as well as a parental involvement law. So minors who need abortion care need to get parental consent. And also this past legislative session, just in 2018, there were 33 provisions introduced related to sexual and reproductive health in Tennessee. 11 of those were abortion restrictions. 17 were provisions that would improve healthcare access introduced in Tennessee in 2018. So that's hopeful that there are more bills being introduced to expand access rather than restrict it. And then of course, these are data points from the 2014 latest Guttmacher report from the Guttmacher Institute. 96% of counties in Tennessee are without an abortion provider currently. 63% of Tennessee women, which is approximately 1.3 million, aged 15 to 44 in the state, are living in a county with no clinic. And other data for context, there are 8 abortion facilities in the state, 6 abortion facilities in the state. They're driving like flies as we speak. No. The median distance, which means half of women are closer, half of women are farther to an abortion facility in Tennessee, is 26.91 miles, which is very far. Comparatively, though, a state with a lot of access like mine, New York, the median distance is only 3.17, but in a state like Wyoming that is very rural and very sparsely populated, the median distance is 168 miles. So that's sort of where Tennessee falls within the landscape because of the hostile legislature, as well as the anti-abortion policy statements with the passage of Amendment 1 in 2014. We would consider Tennessee to be extremely hostile and in the highest risk factor of losing access to abortion should Roe fall, but not necessarily overnight. So, yeah.
So I'm going to cover a little bit of that roller coaster ride on the history of Tennessee, how we went from a restrictive state to probably one of the most liberal states to now one of the most hostile states. So after Roe passed, Tennessee had some statutes on the books that restricted abortion. Then in 1992, Planned Parenthood of Middle Tennessee versus Sunquest was a lawsuit challenging Tennessee's restrictions. It took 8 years for that lawsuit to make its way through the courts. And then finally, in 2000, the Tennessee Supreme Court struck down several of those provisions of the statute and upheld Tennessee's constitutional rights to privacy. And so Tennessee, for many years, enjoyed being one of the most protected states because our state constitution provided much greater protection than the federal government would. So that meant if Roe had been overturned, Tennessee would have been in very good standings. So you can imagine as the state legislature became more and more conservative, that it irked every conservative on that legislative body. And there's a whole process of how you can amend a constitution, amend your constitution. And it took them 14 years to run through the process of having enough legislators and passing 2 consecutive years and can only vote in a gubernatorial election. And so the big fight came in 2014 when this referendum was finally on the legislative docket as Amendment 1. And as you all know, we fought very, very hard, and it was a very close race in terms of almost passing, but it did not. And so we then plummeted to being one of the most hostile states. So basically, what Amendment 1 did was made women in the state of Tennessee second-class citizens. We do not share the same constitutional protection that men do in the state of Tennessee. We had a very strong right to privacy. So I want to tell a little story. Back in the 90s, I went to listen to Sonia Johnson speak. She was a very radical feminist writer, journalist, speaker, activist, and she didn't believe in state and federal provisions. And she spoke about how she thought Roe v. Wade should never have been passed. And I remember feeling anger rising in me as I listened to her, because I thought, well, that's all well and fine for you to say, but what about marginalized people who now have access to care because of Roe? You know, what you're advocating is that, you know, these women would never have had access. And yes, there would be a certain percentage of women that would, but the majority of women who needed those services wouldn't. And she went on to talk about how, with the passage of legislation, that basically the carrot gets dangled. Okay? And what they giveth, they can then taketh away. And I've been thinking a lot about that lately, because here we are in the position of them finally being poised to take it away from us. The other thing that she said was that we were at the point at that time, before 1973 when Roe passed, when women and underground networks were being very well established, and we had a momentum, and that momentum was sabotaged once Roe came into effect. And again, I've been thinking about that a lot lately as we talk about, will clinics survive this new administration and the possible overturning of Roe? And it's actually just reviewed for Tennessee, it does not look good. You know, we have an election year this year. We have an evangelical candidate for governor. That could be quite bleak. We have a lot of state house races that are going on. And for the first time in many counties across the state, we actually have Democratic candidates that are running. I, in my House district, can vote for the first time in 16 years. We have a lot ahead of us in the next 4 weeks. I'm not even going to talk about our senatorial candidate to run right now, because that just makes me too crazy. So, but this election is crucial for the state of Tennessee. If we could flip seats and actually have a Congress in our state that might not pass some of these onerous bills that we know will be introduced as soon as Roe is overturned, you know, we could have a chance, and we could have some movement that's happening and uphold some things. But what does happen if Roe occurs? Can clinics in Tennessee survive? It's a big question. I've been looking at some of the networks that existed before, and many people may know of the Jane Collective that existed, from 1969 up until 1973. Took place in Chicago. Initially, it became known as just Jane. Initially, the collective helped women have access to abortion. So transportations were provided, people found their way to Chicago. This whole network existed around the country. And then they realized that they had doctors that sometimes weren't really doctors that were performing procedures, and they thought that perhaps they could do things better. And in the years that the collective existed, they performed over 11,000 abortions. Quite safely, a woman never died during that tenure and their time. So will we be looking at something similar in the future? Very possible, very strong. Will clinics possibly be clearinghouses? I mean, that's something that we need to be looking and thinking about. Part of underground networks to other states where services will still be legal. Will we be using the abortion funds that exist to help fund those services, to get people directed to where they need to go? What will be the expanded roles in the community? Choices is in a fabulous position right now. They're looking to expand. They're going to be opening their birthing center, hopefully in the near future. Part of that idea was to be comprehensive and have under one roof all the services that women need. Will that still be true? We don't know. The Knoxville Center, where I am, we're trying to expand maybe into primary care services and provide other kinds of things that will help keep us afloat so that then we can be a clearinghouse, if need to direct people places. You know, will telemedicine play a role? In Tennessee it won't, because we already have on the books that we cannot do that as an abortion provider. But will we have access in other states? Will there be online access to medical abortion? We know that there are several countries at the NAF conferences. We've heard stories and presentations from countries that have networks that are set up to provide medication to women. Will we be on the same kind of a thing? That's a possibility. We have many doulas that have formed across the state. Will the doulas play a role? Another thing that we need to think about. And you know, there's a lot of information on the internet right now about self-management, self-abortions. You know, we've seen some horrible things in the past. Things have changed a lot with the availability of medication. Maybe we won't still have all the same horror stories to talk about. And then there's just one other thing that I want to talk about, was that the clergy pre-Roe played a very important role in helping women find services. It was called the Clergy Consultation Service on Abortion, and played a very strong role in getting women. I know in Knoxville, Tennessee, there was a rabbi that people in Knoxville worked with just before I got there. It wasn't before my time, but it was certainly before I got there. And several other ministers that worked. Will we begin to see those networks set up again? So those are some of the ideas sort of rolling around about what will happen if Roe is overturned, and what roles clinics will play if we're still there.
I'd like to introduce you to Danielle Tate, and she's going to talk a little bit about what responsibility is going to fall to the other healthcare providers if there aren't clinics to refer their patients to.
Good morning. You know, this whole question may feel simple because it seems as if the issue is simple in that someone's making a decision to terminate a pregnancy. But from my perspective, it's always very layered. It is a very complicated decision that takes a lot into consideration that I don't think the law takes into consideration by any means. You have a good majority of patients who decide to terminate that need to terminate for health reasons. And that's one of the biggest concerns as a healthcare provider, that now we have these ladies not having this option that could potentially lead to death because the pregnancy is harmful and they don't have that option. And then also the concern, as you can imagine, if patients start to take on things into their own hands and finding ways. I mean, it brings us to think about things like the drug crisis, the opioid crisis, and things like that. People start to find alternative means. And then are we then going to lead into our conversation coming later into the morning of maternal mortality going even higher than it is right now and becoming even more of an issue. So being able to have places where patients can go, if this is the best option to them, is something that we as providers lean on. And you mentioned earlier about physicians being the limiting factor as far as being the ones to perform. We're not the only ones taking care of patients when it comes to women's health. So being able to bring in the other providers to the conversation and help to push the right to have all options for our patients is what we really want. We may not agree, but it's not our life that is being lived. They have to make the best decision for them. And then we often forget about providers who don't do women's health care, who deal with medical conditions that pregnancy could affect, that tend to need to know these same things so that they can start to have conversations with the patients even before they come to see a provider like myself. So it's very layered, right? It's not a simple decision as to say whether I want to be pregnant or not, or I want another child or not. And then we have to give a nod to where we sit in the country and what it means to be affiliated, if you practice, with a religious-based organization that limits then to say, yes, I have a mom dying in front of me, but maybe the hospital will not let me terminate her pregnancy in order to save her life because of what they're affiliated with. So having connections with clinics help us to keep patients healthy. I mean, I think whatever our personal opinions are out the door when the patient steps in, and that's not what it's about. But getting other providers educated, rules, what's coming, and I'll tell you, traditionally, most providers, we're focused on patient care. We forget to bring all this into the conversation. We're just trying to make you feel better, or get better, or take care of you so you don't get sick. But all these things layer in as well, right? I tell my colleagues it's more of the touchy-feely part that sometimes providers don't want to get into, even though we're touching and feeling on you every day, which is crazy, right? But, you know, hopefully by us coming together and rallying, traditionally physicians have not been the ones that you see on the Hill as often as other professions, but getting together and saying that let's look at the snowball effect of this and how then you in legislation plan to handle that if it tends to turn that way, if you get your way in, quote unquote, and we see that we're losing lives because of this, what's the plan then? You know, we have to kind of loosen the reins on us as providers as well to be able to provide care. And if you don't want termination clinics, then are you going to allow us to take care of at least the patients who could die from pregnancy in a facility, a traditional facility like a hospital or a doctor's office?
Hi everyone. This wasn't where I planned to start, but it's how I'm going to bring myself into the room. I've never seen this before in the middle of the New York Times editorial today about what's happening with Kavanaugh is so wrong. They posted, I guess, their pick of all the tweets on this subject, and it said, "This is a done deal. Trump won. The Republicans won. The anti-abortion forces won. If winning is the objective, then no, this is just the beginning." So I don't know about you, but I have long parts of the day where I have to talk myself out of being terrified and having my knees shake. Anybody else feeling that way? And angry, I hear. But this is a good jumping off point and a point of departure for where we have to go further. So far we've been talking really just about abortion, or at least seeming to. And in that tweet, it said the anti-abortion forces won. And that's one of the great things about what just happened. It's helping to clarify some stuff for us, because we can't win in the long run if we don't know what we're fighting. Was it just anti-abortion? And I don't mean it was racist, it was anti-immigrant, it was but was it just anti-abortion? if you have a president who has announced the right to grab pussies, if you have people who are completely insensitive to women who have experienced abuse, harassment, and everything else, it is not just the anti-abortion forces that appear for the moment to have won. It is the anti-human being, anti-woman forces. And to the extent that we have our abortion issues separated from our birthright issues, separated from the sexual abuse issues, as Audre Lorde said, there is no single issue campaign or solution because we are not single issue people. And it's one of the reasons I love Memphis Choices and what they're doing. There are not two kinds of women, women who have babies and women who have abortions. They are all the same women at different moments in their lives, and they're all being denied health care. And they're all being treated badly in the context of their capacity for pregnancy. So what does this mean? If Roe goes, it isn't just about abortion, and will very much about that. But there are many other things, because what Roe did at a minimum, and a very important, not at a minimum, but what Roe did, and still holds to a large extent, is it was asked the question, are fertilized eggs, embryos, and fetuses, in effect, fetuses persons? And the court said no. Now, they've recognized lots of state interests in going all the way back to the beginning of pregnancy, but they haven't said they're separate, complete separate constitutional persons. If and when they do, that is how, not just are we going to lose our right to abortion and how we give birth and everything else, we are literally going to be taken out of the Constitution, something that has never happened in the history of the United States. There are lots of people who still don't have their full personhood, black people, trans people, immigrants, but it is also women. We are not going to be just going back to before Roe, although there were some very powerful things that were happening then that need to be replicated. But we didn't have mass criminalization in 1973. We have mass incarceration and mass criminalization because of the war on drugs. And if that issue scares you and you don't want to touch it, then you are buying into the overarching strategy to take away the rights of everybody who threaten those who have unusual and extreme power. We have a 1,700% increase in incarceration of women. Just in prisons since 1973. The anti-abortion folks like to cling to their own members, and this is one place where we have some, we can reach some folks. They say, don't worry, we can outlaw abortion without outlawing the people who have those abortions. That is not true. As we saw in Tennessee when the fetal assault law was in effect, as we see around the country from cases that national advocates for pregnant women have worked on, defended women like Purvi Patel and Kenlecia Jones, and advocated for Jenny Lynn McCormick, all of whom were arrested already for having abortions outside of medical settings, outside of what a local police or prosecutor thought was appropriate. The principle that fertilized eggs, embryos, and fetuses are not people is what helps us defend a woman who is arrested because she is pregnant. Pregnant and. It's not a crime to fall down a flight of stairs. But Chris Collins fell down a flight of stairs while she was pregnant in Iowa, was reported to the police and arrested for attempted feticide. Women have been told that they must have and have been forced to have cesarean surgery over their explicit objections. You have a right to refuse surgery. Every person has a right to refuse surgery. But the argument is that refusing a cesarean might result in a fetal death. So that's the same as an illegal late-term abortion, or that's the same as a self-abortion. So if anybody thinks that there are some kind of women who are going to be protected, or some kind of people who have the capacity for pregnancy, it is not true. Here are a couple of things I want to leave you with in terms of why I can keep doing this work and why I'm so happy to be here today. Number one, before Roe v. Wade, between 200,000 and 1 million people, women a year, had illegal abortions. They didn't do it with the consciousness of civil disobedience, but that was massive civil disobedience, and that will happen again. And civil disobedience has been the primary way throughout the world and throughout history that we have been able to fight back and bring about change, whether it was Gandhi, whether it was Martin Luther King. That is a form of civil disobedience that people will have to mobilize and recognizes that even if each individual woman by herself is not engaging in having an abortion for that reason. The government cannot control millions and millions of uteruses and vaginas wherever they happen to be. By the way, in terms of arrests, there are a couple of people in this room who are defending and advocating for women who've been arrested in Tennessee in relationship to their pregnancies. Could you raise your hands, please? I know there are at least 2 of you. Don't look around, Aaron. And Alex, are you in here? Just, if you want to hear more about those cases, please talk to those folks, and you can also talk to me. I guess the other thing I want to say, and then I'm just going to try something out on you, is we have to remember we have each other. That in the coming years and months, we will not have the government. It is likely on many levels, or most people don't, especially rural people, and many others. I can't count on the government, but we have each other. We do have medications that didn't exist before 1973. They were alluded to. They're called misoprostol and mifepristone. They can be used safely and effectively to end an abortion. If they remain available, and I don't know if they will, we won't have the public health crisis necessarily. That was part of the pressure to reverse Roe. But we also know there's Antiocha, who used a coat hanger. That we can't count on that safe method alone, but we can count on each other. So I just want to end with this. I had the privilege of being in Memphis, and I went to the National Civil Rights Museum, and I saw this statement. I believe it was by Martin Luther King. There were so many people in there, I couldn't get close enough to read it all. But it said, "For at the heart of racism is the idea that a man is not a man, that a person is not a person. You are a human being. You are a man. You deserve dignity." And if I may, with all respect and appreciation for learning, make that applicable to all of us here and say, for at the heart of misogyny is the idea that a woman is not a man, that a woman is not a person. We are human beings. And I want to hear you say that back to me.
We are human beings.
You can do better than that. I want to hear it again.
We are human beings.
We deserve dignity.
We deserve dignity.
I want to hear that again.
We deserve dignity.
And being part of this healthy and free Tennessee, you are part of what Michelle Alexander calls the revolutionary river. It is Trump, it is the GOP, it is Kavanaugh who are the resistance to the ideals that have never been fully achieved in this country. But you are the revolutionary river, and you are what's scaring the hell out of them, and don't forget that.
All right, we have just a couple of questions that I'm going to pose to the panel, and then we're going to turn it over to your questions. One, and any of you can jump in here that have a thought about this. Some of you may be aware of organizations that are forming now called abortion funds that provide sometimes logistical support, transportation, childcare, and money to women who can't afford their procedures or the costs that are involved in getting their procedures. So I'm curious if the panel has any thoughts about what do you foresee the role of abortion funds being in a post-Roe future?
Well, I think they may play a very vital role. If Roe is overturned, Tennessee becomes one of the illegal states, we have to look around to what are the close-by states and where women will be able to access services if they're further along, if they don't have access, if we don't have access to the medication. So I think those funds may play a very vital role in getting women to the places they need to receive those services. I know Healthy and Free, we're looking at possibly starting an abortion fund. There's a couple of other funds that are around in the Southeast that I know our clinic and probably your choices as well, accesses. We're going to need a lot more money, that's for sure.
I love the NNAF and the abortion funds. My daughter helped to start one in New Mexico. but I just want to push back a little bit and say what I fear, maybe a little bit like the person you refer to, is it's kind of like charity. You know, we need to help women, and I don't want to leave anybody without the health care they need, but they don't just need abortion health care, they need every kind of health care. And if we keep doing charity instead of making sure that as while we're helping each other, that we are actually figuring out how to mobilize and take political action, it will just be charity. It will not be a step in the direction of justice. So I just want to make sure those things are really
We do have an abortion fund at Choices, and but it is not just an abortion fund. It is we call it a patient assistance fund, and so the funds that are there are available to our patients who need any of our services. So we have transgender patients who we support through the fund. We have abortion, hormone replacement therapy. We have regular gynecology. We have PEP and PrEP for HIV, people who are trying to prevent HIV. And we will also include our midwives and prenatal care when that is fully up and running. So as you can imagine, those funds don't go very far because lots of people need health care, all kinds of health care, as Lynn was saying. Another question is the idea of harm reduction and how the field can respond to people who are trying to take this into their own hands. So if the clinics aren't there for them and they are determined that they are not going to carry a pregnancy to term, what are some other options? How can people or organizations help women? How can we be a soft place to fall? How can we support them? How can we provide care?
How many of you have heard of needle exchange? Okay, look around the room. That's a lot of you. Needle exchange is one of the classic ideas of what harm reduction is. It's really a public health approach to problems, most of which are increasingly all health problems and social welfare problems are being dealt with through the criminal law system. So the concept of harm reduction here is, if you know, or as my colleague Naomi Brain says, it's a concept of kind of illegal public health. We know that giving people clean needles stops the spread of HIV. It shows respect for people. It enables them to not die as a result of the drug dependencies they have, the problems that they have. I don't want to use that word, that was a bad word. But anyway, harm reduction is how, and maybe harm reduction or maybe civil disobedience, because it is not clear that it is illegal. But the question is, how many of us will find a way to get a hold of misoprostol and mifepristone, help people, support people when they use it, find networks so people can access it? Because the problem is, I think I have to remind myself, all of the terrible things I fear are not going to happen overnight. It's going to take time. But there could be a federal law banning abortion. The notion that this is going to go to the states and that every state is going to be allowed to do what they want was part of the long-term brainwash strategy of the anti-woman, anti-choice, anti-human being movement. So harm reduction is a term that really encapsulates how do we treat people who need the health care they need as human beings, and participate and maybe be the ones to take the risks to provide them with access the medication or the vacuum aspiration methods that were used before Roe that are safe and learnable. Maybe not by me, but some of you. I know, got a papaya.
I second everything that was just said, and like Corinne mentioned earlier, self-managed abortion looks very different now with the abortion pills, and a lot of states at the grassroots level right now, states like Tennessee, who are anticipating more restrictions, a possible ban should Roe be overturned. A lot of grassroots level activists right now are putting together zines or websites for constituents in their states that connect them to resources and are doing a lot of the ground softening and laying the prep work so that it isn't a reactionary thing, getting resources to people, you know, after it's too late. It's really good to be proactive as early as possible. And so I'd love to share a resource, womenonweb.org, web, W-E-B. Is a great resource where you can just start with getting information and being creative and sort of brainstorming about ways to get this information and education into your communities.
Just one thing that I want to add to that, because it's, you know, we can sort of pick out reproductive health, but what we're really talking about is access to health care, which is a much bigger problem in this country. Every day it boggles my mind that Americans do not think they have a right to health care. You know, if they did, every person would support, you know, a single payer, Medicare for all, whatever you want to call it, access to health care. And we don't have consensus on that. So if women had access, you know, we can see what an enormous impact having access to contraceptive care has had on abortion. You know, the figures, I mean, the country is at its lowest decline in abortion rates. That's a good thing. Of course, we still need abortion services because there are still women who get pregnant with everything that they do and every protection they use. But, you know, the point being that if we have access to health care, we solve many other problems, and that should be a major concern for all of us.
I want to open up to just some questions. We have about, maybe 10 minutes? A few minutes left. So if anyone has thoughts to share or questions for the panel, please just, yeah, go ahead.
So I wanted to remind folks that when many of us who might have been involved in the shelter movement around domestic violence, prior to there actually being physical shelters, we transported people, we had people who stayed in our own homes. I mean, we did this very underground kind of outreach at the same time that we were doing education of everybody, you know, about the rights of people not to be otherwise abused or injured in their home or other places. So the laws that grew out of that grew out of very grassroots efforts. So I just want to say that it's not that women don't know how to do this. It's not that we don't do this all over the world. We know it, and yes, we've got to just ramp back up again around the abortion thing. Which leads me to the thing I keep wondering, like I appreciate this note about this network, this website, but should we be stockpiling in our own home these medications? Is there somebody out there sort of that we believe in? Because I don't know quite how to get in the linkage around, I'm available, I don't, I would be more than happy to be part of this kind of network again. It's just I don't know, I can't figure out where is that in. And I'm very happy to stockpile drugs, and I'm very happy to say loudly, I'm doing it, come get me. You know, because it provides, as we know in every civil rights struggle, every time someone stands up there and says, come get me, it provides a platform for the conversation, which is what's been happening right now, right, around this Supreme Court effort. We have a platform even, you know, we have to talk about these issues. So it's like using this attack as a way to actually expand all these conversations. Thank you.
I just want to add to Women on Web, there's another website called Plan C. So check that out, and SAS, S-A-S-S. So there are several groups that are doing this, and my fear is that, you know, as the state gets more power and the court changes, that they will come after the networks that do this. So you're very right and very brave to be willing to identify yourself as somebody who do that. And I'm happy afterwards to give you some phone numbers of people who've been thinking real hard about those networks.
And I would just say also that stay in touch with this coalition, Healthy and Free Tennessee, because the clinics that are involved in it, we are also having these conversations on a national level. You know, this is something that it's not just Tennessee that's trying to figure this all out. So just stay plugged into one another.
One other thing, Michelle, I know that doulas across the country are also looking at and talking about stockpiling medications. So there are many people on many levels thinking about it. And, you know, I have to address one other thing that you said, which is, you know, the whole domestic violence and sexual abuse thing, we're going back 50 years as well. And so that same kind of networking, we're probably going to go back to as well. And, you know, again, Sonia Johnson's point keeps reverberating in my head, is that we were on the verge, you know, we were in the momentum of doing these things. The creativity, the commitment, the development of different programs. So, and women have that creativity inherent in us, so we will certainly continue to put it into use, but on a whole higher level than we've had to.
Maybe one more question, one more comment? Anybody? All the way in the back, very loud.
Yes, one of the things that I'm concerned about is we can talk about Roe being overturned, but they don't have to overturn Roe to put us all out of business, quote unquote, and I don't mean that as business, you know, to stop it. We've seen it in Texas. We see it, you know, Dr. Parker lives it in Alabama and Mississippi, and, you know, we see all the nipping away at Roe. And now, after Monday's decision from the Supreme Court not to accept the challenge to Amendment 1, that's going to open the door on the next legislative session this next year here in Tennessee for those 48-hour waiting period. Oh, you have to have an ultrasound and sign off on it 4 days before you, and then you have to come back and blah, blah, blah. And then with the clinic, the women's clinic here in Nashville, on Welshwood closing, leaving only Planned Parenthood here. This is, I've been here 25 years. I've been working in reproductive justice for longer than that, in Indiana first, and then coming here 25 years ago as executive director of Tennessee NARAC. And Monday, I was just, after that decision, and then see the clinic on Welshwood closing, my heart is broken, and I know we're going to have to work our behinds off. And it's so important. If every pro-choice person that's running for the Tennessee legislature won in November, it still wouldn't be enough. They've got the votes to put anything through. And if we're not paying attention to that right now, and that's what I really want to hear from you guys, what are we, or for Corinne especially, you know, what in Tennessee now are we preparing for this next legislative session? And then one more website, if you will, on self-directed, that has a big thing on self-directed abortions, and that's reproaction.org. Reproaction. So, I'll let you comment.
So Healthy and Free will be addressing the 2 proactive pieces of legislation that we'll be taking into the new legislative session as of January. You know, it's a very sticky thing here because we don't have the support, and we work closely with a lobbyist who understands the innards of our state legislature and helps guide us to what can we actually be successful at. It's a quandary because, you know, there's some of us that still think we have to introduce legislation knowing that it can be a long passage before we actually see that happen, but that we still need to take these proactive steps and let our voices be heard in that respect. But there's a lot of time and energy that goes into it also, and we're limited in how many people we have and how many people we can have working on issues. So anyway, Healthy and Free will be addressing that a little bit later.
I just want to remind everyone that where we are now is because the other side had a 50-year strategy, and we don't. And we still don't. And that strategy can't just be about abortion. It hasn't worked for 40, 50 years, focusing only on abortion because we have to come together across a whole lot of issues. So, not going to win right away. But I do want to point out that the Tennessee Constitution, I presume, has an equal protection clause, has a due process clause, that it's not only privacy that people trying to still use the courts can turn to. But that's only going to work if there's a movement behind it that says we are full persons entitled to equal protection of law, and full personhood means we get all the health care we need, the people who have vaginas and uteruses need, and that includes abortion, that includes respectful births. And until we believe we deserve that, until we believe we deserve all the health care we need as half of the people, then we aren't going to win in 5 years, 10 years. But if we do that, we can win in our 40 or 50-year plan.
Thank you, Terrell.
All right, yes, let's give them another round of applause for their wonderful comments. So we're going to start back in here at 10:35 for the next plenary. So go ahead and take a little break.